Creatine is one of the most extensively studied supplements in the history of sports nutrition, and yet, myths about its safety persist. Most commonly, concerns focus on kidney damage, liver strain, or dehydration. These fears have been repeated for years, often without any grounding in scientific evidence. In reality, decades of clinical research have consistently shown that daily creatine supplementation, especially in the form of creatine monohydrate, is safe for healthy individuals when used at recommended doses. Far from being a risky shortcut, creatine is now increasingly recognized as a beneficial compound not only for athletic performance, but also for broader health and aging-related concerns. The origin of the kidney myth likely stems from confusion around how creatine is metabolized. When creatine breaks down in the body, it converts into creatinine, a substance that is filtered out by the kidneys. Elevated creatinine levels in blood tests can indicate kidney dysfunction, which led some to assume that creatine supplementation might harm the kidneys. However, this interpretation ignores context. When creatine intake increases through supplementation, creatinine levels may rise slightly, not because the kidneys are failing, but because more creatine is simply being metabolized. Numerous clinical studies, including long-term trials lasting over 5 years, have repeatedly shown that creatine does not impair kidney function in healthy individuals. In fact, even among athletes taking higher than recommended doses, there has been no conclusive evidence of harm to kidney or liver function. Creatine has also been studied in older adults, children with neuromuscular disorders, and patients recovering from surgery, all populations where safety is a top priority. Across these groups, creatine has consistently demonstrated a strong safety profile. While it's true that people with pre-existing kidney disease should avoid unsupervised supplementation, the same precaution applies to many over-the-counter products and is not a condemnation of creatine itself. For the general public, there's no credible evidence that a standard daily dose poses any danger. A typical maintenance dose is 3 to 5 grams of creatine monohydrate per day. This is enough to fully saturate muscle and brain creatine stores over time and maintain elevated levels with ongoing use. Some people choose to begin with a loading phase of 20 grams per day for 5 to 7 days, but this is not necessary for most users. It simply speeds up the saturation process and may cause temporary water retention or mild gastrointestinal discomfort, effects that typically subside with continued use or by switching to a lower, consistent daily dose. Water retention is one of the few side effects some users may notice. This usually reflects increased intracellular water within the muscles, a benign and sometimes even beneficial shift that supports muscle volume and hydration. It is not associated with subcutaneous bloating in most cases and does not indicate fluid imbalance or kidney stress. One reason creatine has endured so many safety studies is because of its widespread use among athletes, military personnel, and recreational lifters. Its popularity demanded scrutiny, and it passed. In fact, creatine has evolved from being seen as just a muscle supplement to a potential therapeutic compound for a wide range of conditions, including neurodegenerative disease, depression, traumatic brain injury, and age-related muscle loss. Researchers wouldn't be exploring these medical uses if there were unresolved safety concerns. It's also worth noting that creatine monohydrate, the most studied and recommended form, is safe, stable, and inexpensive. Other versions, such as creatine ethyl ester, creatine HCl, or buffered creatine, often claim better absorption or fewer side effects, but these claims are typically marketing-driven and not supported by more robust scientific evidence. For safety, effectiveness, and value, plain creatine monohydrate remains the gold standard. That said, as with any supplement, creatine should be taken responsibly. Quality matters. Choose products that are third-party tested to ensure purity and avoid adulterants. People with chronic health conditions, especially kidney disease or diabetes, should consult a healthcare provider before starting creatine. But for the vast majority of healthy users, daily supplementation is not only safe, it's one of the most evidence-supported strategies to enhance performance, recovery, and even aspects of cognitive health. In conclusion, the science is clear. Daily creatine supplementation is safe for healthy individuals, and the outdated fears of kidney damage have been thoroughly debunked. With proper dosing, consistent use, and attention to hydration, creatine is a low-risk, high-reward addition to a modern health and fitness routine. What began as a sports performance enhancer is now proving to be a lifelong ally in physical and mental resilience.